Amy Sullivan might have a job that's as challenging as any in the Lowcountry. She's the Clinical Quality Improvement Manager for Coastal Carolina Hospital, in charge of keeping our local healthcare system improving. Welcome, Amy, and congratulations on the award that you and your colleagues just won. Tell us a little bit about the award, and then we'll go from there.
Thank you very much for having me. Coastal Carolina received an award this year for 2019 from Get With the Guidelines, which is actually part of American Heart, American Stroke Association, for their practice and for their care of evidence-based practice for the stroke patient.
That's terrific. Now, stroke patients are obviously an issue, and you guys, the award comes from the actual care of them when they have the strokes, or is it a lot of beforehand preparation for that?
It's actually beforehand and afterhand as well. It's evidence-based practice, and it's for the care nationwide. It's compared to every hospital within the nation. And Get With the Guidelines works with the American Heart, American Stroke Association to build metrics, and then the hospitals are graded on those metrics. So they're truly looking at numbers and for outcomes of those patients. And then we're awarded based on those numbers and based on the outcome of the stroke patient. Yeah,
outcomes obviously are how we should be measuring it for sure. Has the hospital won this award in the past? This is the first time?
They have. We actually received the Gold Plus Award and the Honorable Elite Plus Award. Gold Plus Award we did receive in 2018. The Honorable Elite Plus is a brand new award this year. There are 3 levels, and Coastal Carolina actually received the highest level.
All right, let's talk about the pre-care of potential stroke patients. That's what part of the award and part of making the outcomes turn out well. What can folks do to help prevent strokes?
The biggest thing patients can do is to monitor, they want to listen to their doctors. If their doctors tell them a regimen that they need to maintain, they need to maintain that. Unfortunately, still strokes do happen. They're very prevalent within the community, within every community. If a stroke should happen, the biggest thing that you can do is call 911. You want to call 911 as soon as those symptoms start, because once those symptoms start, that clock ticks. And we have a saying in the stroke world called time is brain, and it truly is. The quicker you can get to the hospital, the quicker we can treat you, and we can either minimize the effects of the stroke or completely reverse it.
Anything from a preventive side that you guys are recommending? I know every case has got to be very different, and again, you mentioned talk to your doctor. That's the important thing. But what can we do to prevent them?
The biggest thing to do to prevent strokes is just a healthy lifestyle. You want to decrease your salt intake and your fat intake. You want to have 30 minutes of exercise every day, drink lots of water, and like I said, routinely see your doctor. Even if you're not sick per se, sometimes you have pre-existing factors. Some are inherent because of who you are, and some we can change. So it's just seeing your doctor regularly. And
this summer, boy, particularly, you mentioned it, drink a lot of water, stay hydrated. That's a big deal. All right, thank you so much for joining us, Amy. We appreciate the information, and congratulations on the award.
Thank you very much.
Amy Sullivan of the Coastal Carolina Hospital.